Okay, so what we're going to talk about today is Medicare Plan Finder changes. That's the CMS site changes proposed for 2020. Probably not, shouldn't say proposed at this point. They're going to happen. So changes that are going to be to the site. I'm sure a number of you on here use the site. For those who don't, I just strongly recommend you use it. It comes in pretty handy when you're comparing drug plans for prospective clients and existing clients. So this information we're going to talk about today is from the CMS National Training Program webinar. And that webinar more or less went over the changes that are going to be happening to the CMS Plan Finder site for AEP. Now the current site, just so we were talking about the same thing, is the one that's Medicare.gov find a plan /question/home. But if you go to Medicare.gov find a plan, that's going to take you to the CMS site where you can enter somebody's drugs, run the comparisons between drug plans, Medicare Advantage plans, and it'll show the total cost associated with each plan. It'll show you what that consumer factoring in premium, deductible, and expense at the pharmacy. It'll show you how much it's going to cost them for the year, and that way you can find the best standalone PDP form or Medicare Advantage plan for them from a drug utilization standpoint. I've always been of the opinion that the site, when it comes to, from the MAPDs, will also factor in medical utilization. I've always found that isn't very accurate at all. I haven't found that to be a useful tool. Maybe some of you feel different about that, but I've never really valued that portion. But the drug portion, certainly, I think everybody probably agrees that that's a pretty useful tool to use. So as it stands right now, as most of you know, when you're working with clients, anybody can go on that site. Usually your prospects don't know how to use it that well, or if they do, they read it wrong. I've found they read the results wrong. They don't understand that it's all the costs associated when they're showing the monthly cost and the breakdowns. They're saying, well, this plan has a deductible. I should take this one. It doesn't. They're ignoring the total math. So, but as a broker or rep, you know how it works, and so you can see that what their total spend is going to be on a monthly basis. Obviously, it's a very useful tool for us. It takes all the guesswork out of finding the best PDP plan or MAPD from a drug cost standpoint. And the nice thing is, once you did this, you could create a profile, and then it could easily be saved for future use. In fact, my office has done that for years, where we've run the drug comparisons for people, created a profile, saved it, and then every year we can just update it with whatever new the drugs they might have. So per the conference webinar that was a few weeks ago, they're going to have a new site for AEP. They're making overhauls to the site. They're going to start utilizing the new site, take down the old site on October 1st. The new site, not that this helps you, and I'll send this presentation out so you guys can look at this, but it's similar, Medicare.gov /plan compare, and then some hashtag and some stuff in there. But that's the link. And like I said, I'll resend out the presentation. But when you go on the old site, it's going to show you right at the top. There's a banner ad right at the top that says, this site's going live as of October 1st, and then the other site's going to go down, the one we use currently. So on the new site, the big difference is, in order to save a profile on the new site, the user is going to be required to create a MyMedicare.gov account. So they got to create that account in order to use the new site and save the profile. So as I said again, on the old site, when you go on there, if you want to take a look at this for yourself, you go on the old site and you'll see it's right on the top. It shows you the new site, and you can test drive it if you want. So the Medicare eligible person must have a Medicare ID as well, because if you want to create a MyMedicare.gov account, you need a Medicare ID to do that. So somebody who in the past, where we'd go on the site and run comparisons for them 7 months, 8 months before they're 65, and then we'd save those, we won't be able to do that anymore. Basically, they can't get in there to save an account until they have their ID, so a couple months prior. There will be an option on there to quote without registering, but it won't allow you to save anything. So you still will be able to go in there and do an incognito quote or whatever you want, whatever term you want to use. So you can quote and run the drugs. You just won't be able to save anything. And I've been told that option will be taken away at some point, probably for 2021. And we'll go full-fledged where the only way you can get into that account is with a Medicare ID. So right now, if you want to save somebody's profile, you'd have to have them share their username and password with you to get into the account. And again, these changes are taking effect as of October 1st. If you haven't used either site, I'm going to send you a webinar link. Everybody who registered for this, I'll send you a link, a recorded webinar of using the CMS Drug Plan Finder site, even though it's going to change. Because I have, even if there's 2 or 3 people on here who have never used it, you should definitely use it. It's very useful. It's just going to be harder for us starting on October to use it. So, bottom line, what does this mean for agents? Well, nobody's made a specific comment on this, but I think it's pretty clear. This is an attempt to get more people to register for a MyMedicare.gov account. I don't think there's any question about that. That's where it's going. It's being pushed. Most of you have probably noticed that they're really pushing, trying to get people to create an account for MyMedicare.gov. And the site is MyMedicare.gov is being allowed to try to allow the consumer to easily compare drug costs and plans within that site. So they want them to register so they can get in there and utilize the tools to compare and contrast plans. It'll also allow them to compare out-of-pocket costs between Advantage plans, supplements, and even Advantage and supplements. So you can compare between various Advantage plans, compare your supplements, or do a comparison between Advantage and Supp against each other. CMS has also launched a bunch of apps to help consumers make decisions on which plan is best for them, for those of you who haven't noticed. So they've got the What's Covered app, which shows all the coverages in original Medicare. That wasn't that groundbreaking. You could Google search and find that anyway, but they are continuing to develop the price transparency tool. That's a big one. That is going to allow them, once they really get it up to speed, that's going to allow people to see how much an MRI, for example, costed of one hospital versus another, or an outpatient procedure inpatient at the hospital versus going to a freestanding facility. That tool is going to allow them to price and compare and find the lowest cost option for them. The online decision tool helps them decide between an Advantage and a supplement. They have an online service now. They're ramping up to compare out-of-pocket costs between all the plans. So I think all these tools, the goal really is to have consumers be able to shop for plans more easily on their own. Nobody said this specifically, but I think that at the end of the day, you get the consumer educated enough, get them to shop enough on their own. Perhaps maybe there's not a need for as many consumers to need people like us to need brokers. However, having said that, I still think we do surveys in our agency, and we still have 90% of people don't know the difference between an Advantage and a supplement. So I don't think that's going to be any major change, or drastic change, I should say. People might have a Medicare.gov account. They might have all these tools, but will they use them? And are they still going to be able to understand the difference between an Advantage plan, a supplement? A lot of people get confused just trying to get Medicare A and B still, and look at all the online technology they have at their disposal, and they still can't figure it out that way. So I think if more consumers start to rely on their own to use these tools and not need brokers, I think that change will be really slow. I don't think there'll be any immediate impact, and I think it will take time. But certainly over time, I think it'll to a certain extent lessen the amount of, it'll reduce the amount of people that actually just say to a rep or a broker, hey, I need you to do this for me. You'll get some more people that are doing it themselves. So what I was going to mention with this is obviously those changes can be substantial, especially if they take the general comparison tool away at some point. That makes it really difficult then, where you got to get a username and password for each person to run their stuff. So I'm not sure when that'll happen. I think it will, but I don't know when. We do offer some alternatives to this. You can use our Connect for Medicare and our consumer-facing URL. For those not familiar, I do see a lot of new names on this call. Connect for Medicare is our online enrollment. So it's an online enrolling comparison, drug plan comparison tool made by the same people that make the CMS site, ironically. And we offer that to everyone affiliated with us at no cost. They also, if you have a Connect for Medicare account, you also have a consumer-facing URL site at no cost, CMS approved URL that your consumer can go on and do the exact same thing. You can run RX comparisons just like on the CMS site, on either site, your Connect for Medicare account, which is your online enrollment, or you can run them on the consumer-facing URL. Either way, you can run them. Agents can run drug utilization comparisons for PDP and MAPD for clients and save the profiles. That's on Connect for Medicare. Or if a client is a real, DIY or do-it-yourself person, they can do so on the consumer-facing URL. Either way, whether you enroll people through Connect for Medicare, which obviously Connect for Medicare requires no face-to-face, no signatures, it's all electronic, or if your consumer just goes on your consumer-facing URL and is doing all their own research, plan comparisons, either way, you're going to get credit when any sale goes through either site. Full credit is the broker. It's like you did the app with them. So while our solution isn't perfect, because obviously there's some on the calls that don't work with us, those that do work with us on this call, I think Connect for Medicare will make things much easier for you, especially if they take away the general quoting site at some point. What I'm going to try to do now is I'm going to show, for those not familiar, I'm going to show you an example of the Connect for Medicare site and how it works. All right, here we go. So here is an example of the Connect for Medicare consumer-facing URL. Everyone that works with us would have access to this. So the consumer-facing URL, everybody with a Connect for Medicare account with us, and again, it costs nothing, would get this consumer-facing URL that you can put on your website. Or you can just take the link and email it to your client. And just to give you a quick idea, it's all personalized. It'll be personalized to you. Any enrollments done through here would be credited to you. So they can either shop and compare plans by clicking Get Started, or if they already know what they want, they can just click Enroll Now. I'll give you a quick example of the Get Started. Help me choose a plan or view all plans. Again, you're going to see the similarities between this and the CMS site. But let's just assume, instead of entering all the health information, that they want to go straight to the plans. Now, if we did Help Me Choose a Plan, they would then enter their drug information and run the drug comparisons like they do on the CMS site. So here I just put in a zip code. Again, this is good in all 50 states. I put in a zip, and then what it will do is it'll take me to the plans available, and Medicare Advantage plans, prescription drug plans, MA only, and Med Sups. You can see them all on there. For the Advantage plans here, it'll show you. People can compare. They can compare the Advantage plans if they want, like that. They can view plan details. They can add your drugs. If they click Enroll in this plan, you will get credit for that sale as the broker. So really lets them do whatever they want. If they want to look up Medicare supplements, they click on the sub tab. Some states, as you know, require gender, date of birth, because they're banded that way. So you can throw it in there. So gender, no. It's going to ask Part A and B effective date. It wouldn't be on so you can see it, and we'll say 2018. Great. All right. I just want to show you an example of the supplements. Click Continue. And this way they would be able to compare and contrast Medicare supplements as well. They can do PDPs also. And it'll just show you supplement plans. Whatever carriers you're contracted and certified with will show up in here. So whatever the state may be, whatever plans you have in there, they will show up. But this will only show plans that you're contracted and certified with. I'm going to give you one more example here. I'm going to show you the Connect for Medicare account. So that'd be the consumer-facing URL. So again, everybody would get that. You could put it on your website, no problem. And it is approved, and you get credit for the enrollments. Connect for Medicare, that's your enrollment tool you can use to enroll people without a face-to-face. When you go to the site, you log in. Now, you can use the site to enroll people in Advantage, Part D, or supplements with any carrier that you're contracted and certified to sell. So you don't have to go to all different places. There's no face-to-face required. There's no mouse signature required. It's all they just click. You can send specific plan quotes to your clients to have them enroll in a specific plan, or you can send them comparisons and have them pick which one they want out of the 3 or 4 to enroll in. You can start a consultation. That'll create a profile. All this information will be saved. So if you start a consultation for your client, you'll add in all their information. You can run the drug comparisons and then send them the plan, a link to enroll in the plan you want them to enroll in. Or if you already know what they want, you can just send them a quick quote, and I'll use that as an example. This does have a scope function in it that can be sent electronically to them, just to click off on the scope, and that would be saved as well. But we'll just give you a quick example here. And we'll wrap this up in just a few minutes, guys. I said 15 minutes, and I'm already over. So, all right. So basically, if you wanted to put them in an Advantage plan, you just pick the go to Advantage, pick the plan you want out of the carriers available, and just click Send Quote. If you want to compare 3 of them, you can send them a comparison of 3 plans, and they choose which one they enroll in by clicking the button, or you can just send them one, and they can only enroll in that plan. So either way, it makes it easy to do, and you can run, like I said, run the drug comparisons and compare the plans and the drug plans in here. The only difference between this and the CMS site, let me go back to my slides here, would be the only big difference really would be on the CMS site, you can compare multiple pharmacies. Connect for Medicare, we can only do one at a time. So that's one of the big differences, I would say. And then again, I've said it multiple times, but I'm going to repeat once more. Only the carriers you're certified to sell, contracted and certified to sell, will show up on here because it's an enrollment site as well. So they can't have a client enroll and you get credit for it if you're not contracted and certified with that plan. And again, we offer this to brokers at absolutely no cost. Like I said, short and sweet. I did record this. I thank you for joining us today. I recorded the webinar. I'll send it out to you. I'll also send you out a webinar recording for how to use Connect for Medicare for those who want to learn more. And also I'll send you how to use Connect for Medicare in the consumer-facing URL. And again, I'll send you the recorded webinar, and I'll send you a recorded webinar on how to use the Medicare Drug Plan Finder site if you haven't used it already. Like always, if you have any questions, feel free to give us a call at 203-796-5403, or you can email Lisa or I, Lisa@CroneAssociates.com. She handles these kind of questions, or Edward@CroneAssociates.com if you want to speak to me. So thanks for coming on today. I really appreciate it, and hope everybody has a great afternoon and evening. Thanks. Bye.